Why your pain keeps coming back even when treatment helped at first. Hi, I'm Dr. Norris and I'm the clinical director here at Koru Chiropractic. And if you have had chiropractic care, physical therapy, massage, injections, or exercise that helped at first, but maybe your symptoms keep coming back, this video is for you. And before we go any further, I want you to know something important. If you're frustrated or skeptical or feel like you've tried everything, that reaction makes complete sense. In our office, we see people every week who did everything they were told to do. They stretched, they exercised, they rested, they went to multiple providers, and yet the migraines came back, the neck pain came back, the low back pain and sciatica flared up again. Most of these people aren't lazy, broken, or non-compliant. They're just confused because something helped, just not for long. Here's a key distinction most people are never taught. There's a big difference between relief and correction. Relief changes how we feel. Correction changes how your nervous system functions. Most healthcare providers focus on relief. And relief can be incredibly helpful, but relief doesn't automatically mean the problem has been corrected. Your muscles, your joints, your posture are all controlled by your nervous system. If your spine is misaligned and stressed and compensating, your nervous system has to adapt to that. And adaptation is what keeps you upright and functioning, but also creates patterns of stress. So when someone stretches a muscle, cracks a joint, or decreases the inflammation, and the nervous system feels better temporarily, but if the underlying issue hasn't changed, the nervous system eventually pulls the body back into the same stress pattern. That's why symptoms fade and then return. Not because treatment wasn't wrong, but because it didn't really address the root cause neurological issue. This is also why many people say things like, it worked until it didn't. I felt great for a few days. I keep needing more frequent care. Those aren't failures, they're just signals. Signals that the body needs to correct, not just relief. Koru Chiropractic, we take a different approach. We measure posture, we evaluate neurological stress, we use advanced imaging to understand how the spine is actually aligned, and then we make gentle, specific corrections designed to change how the nervous system is functioning over time. No twisting, no popping, no chasing the symptoms. Just precise, conservative care focused on long-term change. If this sounds familiar, if you've had relief but not resolution, that's exactly what we evaluate in our office. You don't need to believe anything blindly, you just need better information. And that's always where real change starts. So if you come into our practice, the first step is to do a 18-point neurostructural testing where we evaluate posture, neurological function, and do some advanced imaging to really understand both the health of your spine and the alignment of your spine and how we can make your nervous system function better and for you to feel better. I'm Dr. Norris. I'm the clinical director here at Koru Chiropractic. Have a great day.